Welcome to the Road to Recovery, Hope and Healing in Mental Health. Joining us today is Dr. Paul Erickson, Medical Director for Psychiatry and Addiction Medicine at Cottage Health, and Dr. Margaret Bauman, Medical Director for Psychiatry and Addiction Medicine at Cottage Health's San Luis Obispo outpatient program. Today we're talking about anxiety disorders. First of all, to open the discussion, what does anxiety mean?
So often when I'm talking with a patient and I ask them whether anxiety is a problem for them, they will ask me, what is anxiety? And anxiety typically means that a person feels worry or nervousness or tension or apprehension. And it can be something that's part of feeling. It can be something that's part of thinking. What if this happens or what if that happens, leading to sometimes thoughts about catastrophe. And it can be physical, where people feel short of breath, tight in their chest, shaky, muscles tense, and so on. So it's a combination of those kinds of symptoms.
Sure.
And I want to add that anxiety in particular, there's a lot of categories of anxiety that we see, anywhere from a generalized anxiety disorder to panic attacks, and those are some of the physical symptoms that Dr. Erickson was mentioning, to obsessive compulsive disorder, to phobias, and social anxiety as well.
So isn't some anxiety normal, though?
Oh, of course it is. And that's the tricky part. Is your life being ruled by the anxiety? Are you overwhelmed with anxiety? Is it interfering with your work or your school or your relationships? Then it moves from just normal worry because I have a test the next day or I've got a big job interview tomorrow. That's normal anxiety. But if it's overwhelming you, running your life, that's quite different.
So some anxiety is normal. It's part of being human. But as Dr. Bauman was saying, when worry becomes constant and dominates your thinking and your life, or when you have so much anxiety that it's hard to go out of the house or drive on the freeway, then anxiety is becoming a problem in your life. Mm-hmm. It's becoming a disorder.
Let me ask you both, what are the different types of anxiety disorders?
Well, there's everything, as I mentioned, generalized anxiety disorder, which is just as it sounds. It's sort of a general anxiety disorder. The worry may take hold in different areas of your life. There's also panic disorder, and that's what a lot of people think of when they think of anxiety, this overwhelming episode of shortness of breath and rapid heart rate and feeling like you need to run and get out. That's certainly a panic disorder, and that's one of the types.
With panic disorder, people sometimes feel so physically overwhelmed by their symptoms that they'll go to the emergency room. They'll worry that they're having a heart attack or some other kind of serious medical condition. But it is an anxiety disorder, and like other anxiety disorders, can be treated. And as with many mental health problems, the anxiety disorders exist on a spectrum. Some people will have phobic anxiety about one particular issue. They may be afraid of spiders, for instance, and it's a relatively minor problem in their life. But other people may have so much anxiety that it's really disabling day to day for them.
How are anxiety disorders treated?
Well, first you have to have a diagnosis of an anxiety disorder, and that requires the interview and working with a licensed, experienced provider to really make an accurate diagnosis. And there are several ways to treat anxiety disorders, anything from therapy, say cognitive behavioral therapy, to medication, to a combination of the two.
And as Dr. Bauman is saying, you do want to see a licensed mental health professional and get a good evaluation. The good news is that there are many good treatments for anxiety disorders, and medications can be helpful, but also specific focused therapies, cognitive behavioral therapy, exposure therapy, other kinds of therapies have good demonstrated efficacy in treating anxiety disorders.
I've got about 45 seconds. What can I do to have good mental health?
There are many things that you can do to help with an anxiety disorder or other mental health problems. And some of the fundamentals are making sure that you are getting good sleep, you are eating well, you're getting exercise each day, and that you have good social connections in your life.
You also want to make sure that you are not relying on, say, other substances, including alcohol, to treat an anxiety, which unfortunately can happen. And then we've got two problems to deal with instead of the one.
To learn more or share this interview with a loved one, visit cottagehealth.org/road to recovery. Tune in next week when we discuss depression and bipolar disorder.